Now, Congressman Anthony Weiner is a Democrat from New York. He's also a member of the House Energy and Commerce Committee. You feel, so big deal, right? They passed it in the Senate. They got a long, long way to go.
Well, it's good news. It's progress. It's another committee weighing in. We're moving the ball down the field. But frankly, the Senate finance bill isn't going to be the law of the land. We're going to need something that has a strong public option. Just yesterday, the insurance industry said what we've all known, but I'm surprised they said it outright, that they're not going to hold down costs, so we have to find a way to do it with competition. But make no mistake about it, this is a good day for moving this thing forward, and the status quo every day gets shaken loose a little bit more, but we're going to have something much stronger as the final bill.
But, Congressman Weiner, your version of much stronger includes a public option, right? Jay Rockefeller's on board. He'd like to see a public option in the Senate, but that's not what we're seeing passing out of this Senate Finance Committee bill. Are you confident that you can get something put back in that will actually get anywhere, that has a public option?
Oh, yeah. I mean, we're going to have to. I mean, one of the things the Congressional Budget Office says, and frankly, economics says, just common sense says, and even yesterday, the health insurance industry says, that without competition, the costs are going to keep going up. I mean, the Finance Committee bill is the weakest of all the bills that has emerged.
But isn't it the most similar to what the president has said he wants?
Oh, no, the president said he wants a public option.
Well, first he said he didn't, then he said he did.
In the speech before Congress, he said he wants a public option. And look, but you've touched on an important point. You can't do any vote count today. Until the president puts his finger scale on some of these various issues, that's worth 10 votes in the Senate and 40 or 50 votes in the House. And so now we're reaching a point where those final decisions are going to have to be made. I launched a website, countdowntohealthcare.com, where we're trying to pressure our moderate friends to get on board with the public option. I'm convinced it's going to be in there. It's certainly going to be in there in the House. And if we want to save money, if we want to have true choice, it has to be in their final package.
But right there's the conundrum, because a lot of people in this country, it's pretty evenly split against and for this public option. A lot of people feel that that's going to lead down the road to government health care, and it's going to hurt the package that they have that they like right now. On the other hand, if you don't have a public option in there, I don't see how you're ever going to, get to the price point that you guys want to be at. So I would think that any Democrat who supports health care reform is going to have to be for this public option. But that's a tough road to hoe when election time comes, because a lot of people out there hate this idea.
Well, just yesterday, the insurance industry put out their own report, not my words, their own report, saying that without a public option, they're going to raise rates as much as 111%. That's the insurance industry telling us in a rare moment of honesty what they're actually going to do.
The White House didn't say it was an honest report at all.
Well, I understand that, but it's an honest sign of where the health insurance industry thinks it's going to go. And to some degree, you've got to give them credit, because they know and they're acknowledging that without competition, the rates are going to keep going up. And for Americans that say, I like my plan right now and I don't want the competition for it, well, they're not going to be able to afford their plan. That plan's going to keep going up $1,000 a year. So Americans, listen, it's going to be a sliver of competition, and it's going to help keep the insurance companies honest.
The CBO says if you start with tort reform, you're going to save $54 billion off of all this.
Over 10 years,
which is
0.04%. We have tort reform. We have tort caps in 46 of 50 states. Not in a single state has the rates come down.
You talk to any doctor. I challenge you to walk into any doctor's office and say, what's the biggest reason that you charge what you charge? They're going to say, because of my malpractice insurance.
Yeah, because the insurance companies get the laws changed, and then they pocket the difference.
The
health insurance companies
be addressed in one way or another.
The health insurance companies, if we don't keep them honest, they're going to pocket whatever savings we get, take it and pass along the bill to us. You better believe it.
All right, Anthony Weiner, thank you very much, Congressman. Good to talk to you.